Hello everyone, Dr. Oommen and I here to answer more of your coronavirus questions. Some of you may have heard that today is World Health Day. So this is in fact a campaign that was created by the World Health Organization in the 1950s, and it's used to promote both physical and mental health. Every year it's dedicated to a different group of healthcare workers, and in fact this year we're dedicating it to nurses and midwives. And this is in order to remind world leaders about the critical role that they play in keeping everyone healthy.
And the World Health Organization says that nurses and midwives account for nearly 50% of the global health workforce. And in Quebec, that works out to about 71,000 nurses.
It's amazing. And nowadays, the role that nurses are playing are in health promotion, disease prevention, delivering primary care in and around the communities. And really, they've been critical during this coronavirus pandemic.
So true. And we came across this quote from one of the WHO directors that we thought was really appropriate. So I'd like to share it with everyone. Nurses are the unsung heroes of the COVID-19 response. The invaluable role they have played is testimony of the sacrifice, courage, and commitment to a healthier and safer world. I really thought that was appropriate from one of the WHO directors.
That's great. And in light of this World Health Day, we thought we would just take a minute and talk about some of the good things that are happening in and around the medical community.
Yes, Dr. Liello. So some of you may have heard of the technology called CRISPR, really exciting new technology where we're talking about gene splicing. You cut out the bad gene and you have the ability or the tool to put in the right gene that you want, like gene editing. And it's been used for the first time in an attempt to cure a rare form of genetic blindness.
Wow.
So kind of exciting first steps.
That's really amazing. Another study, so researchers have announced for the second time ever, a patient carrying the HIV virus has been declared cured. So this means there's no trace of the infection even 30 months after stopping traditional treatment. So this is really, really a good step forward.
Exciting. And how about this one? A potential universal flu vaccine has passed some of the first hurdles in human testing. So we know that the viruses are kind of like always changing every year. That's why we have to come up with a new flu influenza vaccine. But there are some common targets that all flu viruses share. So they're looking for that single magic target that is common to all flu vaccines. So maybe we just need one vaccine that could hit all the common flus. Now, of course, coronavirus is not exactly a flu, but it's a step in that direction.
Yeah, this is great. And I think it's going to help really promote more people to get vaccinated. So these are some really interesting points that we thought going around in and around the medical community. We'll get into the coronavirus questions. So as I mentioned in the last video, we wanted to spend a little bit of time talking about the actual test. The coronavirus test that's out there and available. So why don't we just get into it?
Yeah, thank you. So some of you who heard the conference with Premier Legault today, he was talking about the scarcity of swabs. So the swabs to test if somebody is positive or negative for coronavirus. And you may have heard he said there's only about a week left of the test. Wow. So these things are changing in real time. These are how things evolve during a pandemic. And the numbers change and the demands on society and the health systems change. So we all learn in real time together. So the doctors were sent recently a letter reprioritizing who can get the test and when. So given the current situation, unfortunately, the testing for the public has fallen quite low on the list because the government and public health wants us to prioritize the frontline healthcare workers who are in contact with the highest risk people who need to be protected and who can also spread it to many people if they're positive. So this means that the public will be tested a lot less. And of course, this will affect all of the statistics that underlie how we view the coronavirus. So that, of course, will influence how we view the evolving pandemic. But Dr. Liello, I think you have some personal experience with the test itself.
Yeah, so it's a good point. So early last week, I started to have a bit of a cough, productive cough, very mild shortness of breath. But because we're still here, we're seeing patients, the exposure was possibly there. So I thought it would be important to get tested. So I called the 811 number, was given an appointment. And so the next day went in. And I just thought, I'll kind of talk you a bit through the process. So in fact, they place you in a room. It's a pretty small room. You're facing the wall. The entrance is behind you. And so the nurse comes into the room and she starts asking me questions, but from behind me. So I think it was more to reduce that droplet transmission as much as possible. So just went through my symptoms, possible exposures, and explaining the process of the test itself. So in fact, we talk about it quite often. It's this nasopharyngeal swab. So it's in fact a pretty thin swab. It's about this big, and they start by just swabbing the back of your throat, like you would get in a normal kind of strep test if some of you have experienced that. And then with the same swab, they actually kind of tilt your head back and go in the nose all the way back to the throat. So it is a little bit uncomfortable. They do have to stay there for about 10 seconds to get an adequate swab. But then it's over and they send the sample out, and usually they say they'll get back to you, within about a week.
That's very interesting. Dr. Liello, that process sounds very detailed and a thorough, organized process. How come there's only a 50 to 70% accuracy with this test?
Yeah, it's a really good question, and we mentioned it in the last video. So 50 to 70% sensitivity on the test. So that means at least 30% of the people who have the test and it comes back negative, it's a false negative. So it means they have the virus, but the test doesn't detect it. So there's a number of reasons why this could happen. So first thing is the way that the specimen's collected. So it's possible that it was just not collected properly. Either, the swab didn't stay there for 10 seconds. It was just a little bit too quick, or it wasn't tolerated by the person actually getting the test done. Another thing is in the way that it's handled and transported. There's a lot of things that could happen there that could alter the sensitivity of the test. Another important thing is if you go very early on, you might not have actually enough of a viral load to be detected by the test. So that's a huge one. There's also these things called amplification inhibitors. So what are these? These are essentially things in the test that could block our ability to detect the signal coming from the virus. So there are hundreds of these. It could be various components that are found in saliva or in sweat or other bodily fluids, things that are found in the environment like pollen or even the powder from the gloves that are used. There's different bacteria that could prevent that. So really a lot of things that could alter the accuracy of the test.
Important. So the test is not as straightforward as it appears.
Right.
And I was thinking, what if the virus mutates? So the test kit is looking for a match with the virus RNA, the virus particles. But the virus is mutating as time goes on. So far, like minor mutations, hopefully no major mutations. And then we won't find that match because its RNA has already changed. That's going to turn out to be a false negative.
Yeah, exactly. So the marker that we use to detect the virus is always the same. But if the virus is changing, it'll just come out as a negative test. We'll never be able to detect it.
Interesting. I was thinking, Dr. Liello, we've been at this since about December, and I feel like the end of winter was a bit of a blur and the beginning of spring was a bit of a blur, and I'm kind of like in this holding pattern, where time is standing still for now. And I always look forward to summer. We don't have to put on our boots and our hat and our scarf and our big winter coats, and we can just go out in our shorts and t-shirts. But it seems like, I still have to put on my gloves and my mask.
Yeah.
So, then I was thinking maybe we should all stop waiting for something to happen, because I think this will be with us for a while. So maybe we'll adapt to this new normal, and we'll try to normalize this as much as we can and get on with our lives.
Yeah, I think that's well put. And you know, you could still keep your t-shirt and shorts, but you might want to save a t-shirt or two just to make a mask, like we were showing you in yesterday's video. So that's all the questions that we have for today. So as always, we hope that you stay safe and best of health.
Be safe, everyone.